What really happens inside your body when you use cocaine? For a short time, you may feel more energetic, confident, alert, and powerful. But while your brain is experiencing that rush, your heart and nervous system are being pushed in a completely different direction. And some of the most dangerous effects of cocaine can happen much faster than most people realize. Today, we are going inside the brain and body to understand why cocaine creates such an intense high, why that feeling disappears so quickly, what it can do to your heart, and why using cocaine with alcohol can make the situation even more dangerous. And there is one additional risk in the United States today that many people may never see coming. Let's start with the brain. Cocaine is a powerful stimulant. One of the reasons it produces such intense effects involves dopamine, a chemical messenger that plays an important role in reward, motivation, and learning. Normally, dopamine is released between brain cells, sends its signal, and is then recycled. Cocaine interferes with that recycling process. The result is an unusually strong dopamine signal in the brain's reward system, contributing to feelings of euphoria, energy, confidence, and increased alertness. For a short period of time, someone may feel as though they can talk more, think faster, stay awake longer, or accomplish almost anything. But there is a catch: the high does not last. As the effects wear off, some people experience what is often described as a crash. That can include fatigue, restlessness, depression, increased appetite, disturbed sleep, and a strong desire to use cocaine again. Repeated use can eventually lead to cocaine use disorder, where cocaine becomes increasingly difficult to control despite the problems it is causing. And this is where cocaine becomes especially deceptive. The person may begin using it again, not simply to feel amazing, but to escape the crash that follows when the drug wears off. That creates a cycle. Use cocaine, feel the rush, crash, crave another dose, and repeat. But while all of this is happening in the brain, the heart is dealing with its own problem. Cocaine can increase heart rate and blood pressure. It can also contribute to narrowing of blood vessels. So your heart may be beating faster while simultaneously working against increased pressure in the cardiovascular system. Possible complications include abnormal heart rhythms, heart attack, and stroke. Cocaine can also increase body temperature and cause agitation, sweating, enlarged pupils, and restlessness. And being young does not make someone immune. Neither does going to the gym. Neither does looking healthy. A person can appear to be in excellent physical condition and still experience a serious reaction to cocaine. At higher levels of intoxication, symptoms can become much more severe. A person may become confused or extremely agitated. Blood pressure and heart rate can rise dangerously. Seizures, irregular heart rhythms, breathing problems, loss of consciousness, and death can occur. Now let's talk about something that happens frequently in social situations: alcohol and cocaine. Someone might drink several alcoholic beverages and then use cocaine because the stimulant makes them feel more awake. But cocaine and alcohol do not simply cancel each other out. When both substances are present in the body, the liver can produce another active substance called cocaethylene. Research has linked combined cocaine and alcohol use with greater cardiovascular stress and increased risk compared with cocaine alone. So, feeling less tired or less drunk does not mean your body is safer. The opposite may be true. Your perception of how intoxicated you are can be very different from what your cardiovascular system is experiencing. And now we get to a risk that is particularly important in the United States: fentanyl. Illegally manufactured fentanyl can be mixed with cocaine, and the person using it may have absolutely no idea that fentanyl is present. You cannot reliably identify fentanyl simply by looking at a powder. The CDC warns that illegally made fentanyl can be mixed with drugs including cocaine and methamphetamine, creating the possibility of unexpected opioid exposure and overdose. Recent US data also show that fentanyl and stimulants are frequently detected together. That does not mean every sample of cocaine contains fentanyl, but it does mean that the illicit drug supply can be unpredictable and someone may be exposed to more than the substance they believe they are using. And that unpredictability changes the risk completely. A person expecting the effects of a stimulant could instead develop an opioid overdose involving dangerously slowed or stopped breathing. This is one reason cocaine related drug use in the United States has become even more complicated. There is another consequence that develops more slowly: addiction. With repeated cocaine use, the brain can adapt to powerful artificial stimulation of its reward system, ordinary experiences may begin to feel less rewarding compared with the intense effect produced by the drug. Cravings may become stronger. More time may be spent thinking about cocaine, finding it, using it, and recovering from it. Eventually, cocaine can begin competing with relationships, work, health, sleep, money, and almost everything else that used to matter. That is why addiction is not simply a question of weak willpower. Substance use disorder involves changes in brain function and behavior that can make compulsive drug use extremely difficult to stop. So, when someone asks what cocaine really does to the body, the answer is much bigger than a temporary burst of energy. It overstimulates the brain's reward system. It increases stress on the cardiovascular system. It can raise heart rate and blood pressure. It can contribute to serious complications, including heart attack, stroke, seizures, and dangerous heart rhythms. Combining it with alcohol adds another layer of risk. And in today's illegal U.S. drug supply, fentanyl contamination can make the contents of a substance even more unpredictable. The high may last only a short time, but the consequences can last much longer. And some of the most dangerous effects are the ones you cannot see happening inside your body. If you found this video helpful, subscribe to Terry Health for more science based explanations of what everyday habits and substances really do to your body.